Hello everyone, I welcome you to my YouTube channel Midwife Unity. Today in the second episode of the Midwife series, we are going to look at the leaking fluid in pregnancy. On my TikTok, which is of course Midwife Unity, we were having a series of amniotic fluid and how to tell whether the leaking fluid is meaning that your water has broken. But in this video, I really want to summarize what is amniotic fluid. Amniotic fluid is the fluid that protects the baby in pregnancy. Some you will hear them say that the baby feeds on it. Some you will hear them say that it is the baby's urine, but it really protects the baby during pregnancy. But my main issue today is the leaking fluid in pregnancy. Sometimes leaking fluid may mean that your water has broken, but it is not usually true. At times, when the pregnancy is 37 weeks and above, some women, after coughing or laughing, they usually feel the wetness in their panties. That does not mean that their water has broken. Meanwhile, some people, it can be leaking urine. So we looked at the differences. How do I tell that the leaking fluid is amniotic fluid, which is the baby water, or it is urine, and what to do when I tell the difference? We said that urine has a color yellow and amniotic fluid has literally no color. The second difference was urine has a smell and amniotic fluid is usually having a little or no smell at all. The third difference we looked at was that urine can be controlled. You may feel that your urine is coming and you try to control it by placing your pelvic muscles. Then for amniotic fluid, when it is leaking, it cannot be stopped or it cannot be controlled. We went ahead and said that, however, if you see the fluid that is coming is having a color brown, is having a color green, it is bloody, or it is having a foul smell, you are really supposed to run and seek medical advice. What else did I want to talk about concerning amniotic fluid? Another thing that we looked at was that it is always not that the amnio. It is always not that when your water breaks, it has to burst or it has to gush out. Sometimes it is a little leakage, and this sometimes leads to premature labor or miscarriages. So in case you see a fluid that you are not able to tell whether it is the baby water, which is amniotic fluid, or it is your urine, please run and see a healthcare provider for immediate intervention. Because if it is urine, you'll confirm it is urine. If it is amniotic fluid, then you will receive the care to protect the baby. Hope this is helpful to anyone who is pregnant right now or is preparing to have a baby. See you in my next video. Bye. Negative.